And we have an army of budget analysts in the budget office whose job is to find the padding. It's wonderful. Budget season is a huge game of hide and seek in which nobody's telling the truth and nobody trusts each other. It's great fun. Then we get to the elected officials, and they have to, in an environment like this, they have to really mete out the pain, cut costs, raise taxes, raise fees, get blamed. But the important point here, the important points are the last two. What does all the debate focus on? What does 99% of the energy in this process focus on? It focuses on any tax increases or fee increases and spending cuts. That's where all the noise is. That means it focuses on 5 or 10% of your budget. And the other 90 or 95% slides through unexamined every year. So budgets change things very incrementally, typically. The other important point is when elected officials have to make, when legislators have to make these final decisions, what's going through their heads when they're meting out the pain? There are some of them who are thinking, how can we together produce the best results with the money we've got for our citizens? Others are thinking, how can I avoid inflicting too much pain on my voters before the next election? And that's why we continually get these short-term solutions. We rob Peter to pay Paul. We borrow from our pension funds. We do all these short-term things to kick the can down the road, which makes our long-term problem more severe. Now, that's democracy, but it doesn't have to work that way. This isn't the way we always budgeted. Budgeting systems have evolved over the years, and there's a different way to do it, which my company helped invent in 2002 in Washington State with Governor Gary Locke, who came to us and said, we have a 14% shortfall. We've already made across-the-board cuts. We've already laid off 1,500 employees, and I hate doing it that way. Help me. How could we do it differently? We developed something called Budgeting for Outcomes, which has spread to at least this many places. We've worked with most of those. There are others I keep hearing about who've done it on their own. It's spreading rapidly, and it is the single most powerful tool I have ever seen to deal with fiscal problems. So I want to walk you through it so you understand how it works. If I give you generalities about it, it won't mean much. If I walk you through the process quickly, you'll get it. So that's what I'm going to do. Basically, this is a way for your elected officials, your governor and your legislators, to quit micromanaging and instead focus the budget on the big questions. What price of government are you going to charge your citizens? How much should you spend? You decide that up front. How much of their personal income are they willing to devote to government? They've been telling you at election time for decades. And in Oregon, as you heard, state and local together, it's 16%. Secondly, what outcomes matter most to your citizens? And you already know that because you have the Oregon benchmarks. Third, how much should you be spending to achieve each of those outcomes? How much is better education worth compared to better public safety or better health or a better environment or better transportation? And then finally, how can you best deliver each outcome? So when I talk about outcome goals, typically a state will pick 5 to 10 to focus on. And the first time Washington did it, they picked 10. These are 5 of them. Better education is always on there. Better health is always on there. Better economic vitality is always on there. Mobility is always on there. Public safety is always on there. And something about the environment or natural resources is always on there. Those 6 are standard in any state that does this. And frankly, at this level, these goals are not Democratic or Republican. They're not hard to reach. Usually states involve citizens with surveys and focus groups to ground them in what citizens really want and create credibility for the process. Then you decide how much they're each worth. And this is not science, this is value judgments. This is where you can begin to make some big value judgments, some big decisions, some big changes. The leaders who do this, and I would argue that usually the executive does this, then they hand the budget to the legislature. I would argue that in a fiscal crisis like this in your state, you would be wise, the governor would be wise to bring the legislative leadership onto his leadership team to develop the budget and go through these steps because you need to make big changes and you need to make them fast. When you decide how much each outcome is worth, you can change those numbers later in the process, but what you're doing is creating a finite pot of money for each outcome, and then you're going to make your programs compete for it. So this is the fun part. How do you deliver on that outcome? You create a team of people with strategic thinkers with expertise in the area, one around health, one around education, etc. We call them results teams. And again, you could include both legislative staff and executive staff. And we always urge folks to bring some knowledgeable outsiders in because they can think outside the box more easily than your state people. They figure out what's progress, how are we going to measure this outcome? Let's pick 3 indicators for each outcome. That gives us a report card on how the state's doing in terms of what citizens care about. We can report to the citizens every year. And then second, the team always wants to go to, what did we spend on this last year? And we always tell them, no, we're going to ignore that for the moment. There's a more important question, which is, what drives this outcome? What really creates better health in a community or better education? What are the forces? And since we have very knowledgeable people on the team, and they have some time to do some research, they delve into that question, and we ask them to make a graphic of the answer. We call it a cause and effect map. And this was Washington State's health map in 2002. Every bubble on that map is a factor that affects the health of a community. And the research tells you that they boil down to 4 big things. What's in the environment? The air, the water, the workplaces, people's homes. Secondly, personal behavior. You know, your lifestyle, your diet, exercise, smoking, drinking, drug use, etc. Third, access to health care. And fourth, risk factors. Genetic risk factors like how many of your population has a genetic predisposition toward heart disease. And socioeconomic risk factors like how many of your population is poor. Because being born poor in America is a huge risk factor for bad health, poor health. So when they do this, they look at data, as I said. And the data tells you, this is about 10 years old, we spend twice as much on this as health now, but the data tells you that half of the outcome is driven by personal behavior and only 10% by access to care, but we spend virtually all our money on access to care. The point is, when you look at this data, you're going to say to yourself, hey, we're funding the wrong strategies. We need strategies to change public personal behavior in this state. That's the most important thing. That's where we get the bang for the buck. So that analysis would lead people to say things like, we want a strategy to change lifestyle choices, or we want a strategy to focus on prevention, prenatal care and the like. Or the data might tell you that in your state, a lot of people are using the emergency room as their primary care doctor. And so you need a strategy to change that because it's expensive. Everybody's decided already we need electronic health records, so you're all working on that. But my point is, the analysis is designed to develop a set of strategies for the state. And those strategies go into the budget instructions, if you will. We like to call it a request for results. And that request says, this is the outcome we want, here's how we're going to measure it, here are the strategies we want to fund, here's how much money we have. Tell us what you can do. And that goes out to every department, every program. And someday, if you want real competition, it'll go out to the private sector and the nonprofit sector as well. But for obvious political reasons, that's not happening yet. So the sellers in this marketplace then make offers. If I'm running a program, I have to say, here's what we do, here's the level of performance. You know, this many outputs for this dollar figure yielding these results. And here's the performance data that backs up my assertion about that. and here's how much it will cost. I have no guarantee I'll get funded. I'm in competition, and I submit this request to one of these teams because it's either to produce better health or better education or better mobility or one of those goals. It's an opportunity for me to innovate, to come up with new ideas. And if you do it right, you train everybody to get them thinking about new ideas. Then the results teams rank the offers. They use what data they have to rank them from most cost-effective to least. And remember, they know exactly how much money they have, so they start buying, if you will, from the top, and at a certain point the money runs out and they draw a line. And what we've learned in doing this is that managers typically, more than half of them will look at this exercise as another flavor of the month. And they'll figure this too will pass, and so they'll just take what they did last year, put it on the new form, turn it in. So we learned that to motivate them, we send out the rankings, and we show them where they are in the rankings. And if they're beneath the line, it means no funding is recommended. And that gets their attention. Even if they're just above the line, it means somebody might improve their offer, and they might drop below the line. So at that point, you tend to get innovation. In one place we did this, 80% of the second round offers had been changed from the first round. And that's what you want. You want all of these folks thinking, scouring the globe for best practices, cutting-edge innovations that will produce better results for less money. So those come, and some examples, just to show you how this works. In Iowa, which probably did the best job of this of any state under Governor Tom Vilsack, the head of the corrections department came in with his offers, all his offers, sat down with the head of the results team on public safety. And the results team person said, Gary, this looks like what you did last year. And he said, yeah. And she said, is that really what you want? Is that your vision of an ideal corrections department, what you did last year? And he said, well, was that the question? And she said, yeah, that's the question. So they had a spirited discussion about what an ideal correction system would look like. And then she said, go back with your people and put that into your offers. So he did. And they decided to make lowering the recidivism rate, the rate at which people leave prison and then recommit crimes, lowering that rate as their key target. And they developed a lot of innovations to drive it down. They did very well in the competition that year because their offers were innovative. In Washington State, the second year they did this, the people in the health department looked at the data, and it says if you invest in alcohol and drug treatment, your emergency room costs will go down because fewer people will show up in the emergency room after drinking or taking drugs. Common sense. But that's what the research supports. So they said, let's take $85 million of Medicaid money and move it from the emergency room to alcohol and drug treatment. And after the whole process was done, they got about half that, about $45 million. So it's designed to produce those kinds of breakthroughs. So the results teams do get these final offers, rank them again, draw the line, and then they present their recommendations to the leadership team, whoever that is, whether it's just the governor and his staff or it's the governor and the legislative leaders together. And those people make the final decisions. They always have to make adjustments. There are offers above the line, below the line that are mandated by the feds or mandated by the courts, and you have to move them up. There are offers below the line that are the pet project of the House Majority Leader, and it would be suicide to leave them below the line. Sometimes the leadership team looks at it and says, you know what? We didn't put enough money into one outcome or another. So in Washington State, the first time they did this, they shifted some money from 2 outcomes to public safety because the cuts in public safety that they were going to have to push through were too draconian. So you make the adjustments, and then you put your budget together. And if you're smart, you organize it by outcome, not by department.